What I'm going to do is I'm going to put up a number of lines on a graph that summarize the relationship between education and percentage of people employed after SCI onset. And I'm going to do it for 4 different groups, so 4 lines in total, based on injury severity. And I'm going to start with the group the least severe injured, and these are what we would call Asia D, or people that have neurologic functional recovery that allows them to do things because they have not had a neurologically complete injury, and they're able to do things that are functionally helpful to them. And if you look at the graph and you look at the line, you note that only about 12% of the people are employed who have less than a high school education. The line increases slightly with a high school education and then improves dramatically among people that have at least an associate's or 2-year degree. After that point, it increases slightly, but really plateaus such that if you drew a line straight across, it is about 60% if they have an associate's degree, or whether they have as high as a master's degree or more. Now we're going to put another line on the graph, and these are for people that have non-cervical injuries, but they are not motor functional. And this is the group that people commonly would consider paraplegia, people that have full function in their arms, but have paralysis of the lower area. And as you can see, this group does not have the same employment outcomes at lower levels as those that were less severely injured, and that the relationship between employment and their education, however, is somewhat similar, in that again you see a fairly substantial gain around an associate's degree, and then you see improvements peaking at about over 70% among those with a master's degree or higher. Then if you look at the next group, these are those with lower cervical injuries. And lower cervical injuries are people that have some impairment of their arm function. They can do some things, but they do not have full functioning in their arms. And you can see that not only are the outcomes more limited among this group, in the sense that their employment rate's substantially lower at all but the highest levels of education, but the form of the relationship is different. It's a much straighter or more linear line. So the increases with an associate's degree now are only about at little over 30% employed, and at a bachelor's degree you still only see about 50% employed, which is substantially less than those with a higher level of education. And then lastly, we'll look at the group with the most severe injuries. These are people C1 to C4. They may have very limited use of the upper extremities, if at all, mostly shoulder function, if that. And as you look at the line, you can see they do more poorly with less than 11 years of education. At a high school, there's a very small bump, barely above 20%, with an associate's degree. And even with a bachelor's degree, the employment rate is less than 40%. And it's only when you see a master's degree do their outcomes match that of the other groups. So one might draw the conclusion that, at least within this study, that education is the great equalizer. It equalizes outcomes for people with varying levels of severity, but only at the highest levels of education. The implications for rehab counselors, for planners, is that if you have someone with a not too severe spinal cord injury, either motor functional or someone that has a non-cervical injury, you can improve outcomes substantially, almost dramatically, with a 2-year degree. As you get into people with cervical injuries that are not motor functional, you're really going to have much more education, and it needs to go beyond a bachelor's degree to a master's degree or more if you're going to maximize outcomes among that group. And that is the goal, to maximize the employment opportunities and the outcomes of all people with SCI. Thank you.